Just as Carrie was saying, it is May 2022, and it is Mental Health Awareness Month. So Dr. Egu and I thought, what better time to talk about mental health, and specifically a topic that's very important with regards to, reaching out for supports, the stigma of mental health. Again, very important topic to us. We're finding more than ever that people are trying to reach out for support with mental health, and hoping that this presentation will shed some light on how common it is to struggle with mental health. We'll be talking about the relationships of mental health and physical health, and just how common it really is, if not more common than having a physical illness. So, yeah, let's dive right in. There we go. All right. So real quick, just before we get started, a quick disclosure. So the presenters, Dr. Egu and myself, have no relevant financial relationships with commercial or industry organizations, as well as the planning committee for this presentation. As Carrie was saying, we're here after hours. We're doing this because we are definitely huge proponents of mental health, advocates for it. And we're just hoping that, this will shed some light on allowing people to be able to speak up and reach out for support when they need it. Okay, so some highlights to go over. This is what we're basically going to be talking about in our presentation. So to start us off, Dr. Egu will be talking about defining stigma. So I know that we've been talking about, stigma of mental health, but the term stigma, it's very activating, as well as a lot of people have different understandings of what stigma is. And so we'll just be breaking it down and kind of defining terms for all of you. Then we will be diving into facts and stats, as I call it. So basically just some research that I found to be rather eye-opening. I've been a mental health clinician for some time, and I was pretty surprised at some of these statistics. So good information for you all. And then also just, I wanted to give you guys some statistics on, so just some information to help understand that I think sometimes in mental health, it can feel very isolating. You feel like you're the only one feeling like this, or you're the only one struggling with this, hence why we're bringing the stigma of mental health to light. So some of these statistics will help you understand, like, mental health disorders are global. The entire world struggles with it. So important to kind of look over some facts that I found. Then we'll be diving into affected systems of mental health. So I'll be defining kind of what those systems are and how each one is related to one another. Then we're going to be touching on an interesting topic for me, mental health stigma and physical conditions. So the big one with that, as I'll be getting into further, is basically, we have the stigma of mental health being this kind of taboo topic, that it's like, oh, mental health diagnoses and who's got this and who's got that. But in reality, we don't really feel like that with physical conditions. When someone says they have diabetes or someone says they have asthma, it's kind of like, oh, okay, everyone has it. So trying to bridge the gap between how mental health disorders are as common, if not more common, than physical illnesses a lot of times. So we'll be delving into that. Then Dr. Egu will take over and talk about what I think is one of the most important topics of this presentation, implicit bias. Basically the unconscious judgments that we make very quickly about individuals that we see and don't know anything about. Judgments based on color of your skin, sex, gender, religion, stuff like that. That affects how people interact with one another, as well as how systems interact with one another. So she'll be talking more about that. And again, another incredibly important topic, cultural barriers. We all come from different cultures, different households. And so Dr. Egu will be kind of delving more into how that affects mental health and the stigma of. All right, I'll hand it off to Dr. Egu.
Thank you, Dr. Dollinger. So I'm Dr. Egu, everyone. It's nice to be with you all today. And so as Dr. Dollinger mentioned, we're going to first start off by defining what is stigma. So stigma is sort of these negative stereotypes, labels, judgments, and prejudice that can lead to discrimination. So, the key takeaway with stigma is that it's often negative. That's the association we have with it. And so breaking down, within stigma, the differences between stereotypes, prejudice, and discrimination. So stereotypes are sort of these generalized beliefs. So, there's sort of this stereotyped belief I would say overarching that people with mental illness are violent. And I'll get into that a little bit later. Certainly with the recent shootings that we've been hearing about, there seems to always be a correlation or, the narrative that, because someone committed this atrocity, that somehow there's a mental illness component to it. And that's not always true or relevant. And so it sort of furthers this narrative that, mental illness equals violence, which is certainly not the case, and research supports that. And so we have also prejudice, which are these sort of judgments that are based on the belief that, quote unquote, that are based on, these stereotypes that we have. So if I have a stereotype that, folks with mental illness are violent, what that does for me is, it perpetuates for the belief that I'm scared and I don't want anything to do with anybody who has a mental illness, who I perceive to have a mental illness. And as we can see, we can certainly understand and recognize how that will perpetuate, stigma and really stigmatize in mental illness. And those stereotypes and those prejudice beliefs certainly lead to discriminatory practices, both on a personal level and on a systematic level, which we'll sort of go into a little bit more later on in this presentation. So if I have a belief system that people with mental illness are, quote unquote, violent, right, I'm going to treat them differently. Right. So if I'm a business owner, I may not hire, someone who disclosed that they have a mental illness. I may not rent up to a person that, disclosed that they had a mental illness because I may be scared of them. Certainly as a healthcare provider, right, that certainly influences, not only access to healthcare, but the type of treatment and service that I, as a healthcare provider, might provide if I have this, this belief system about mental illness. So we'll get into a little bit more of that later in our presentation. So a different type of stigma are what we call self-stigma. So self-stigma are sort of these internalized belief system that affect not only our self-esteem, but, our sense of self-efficacy. And oftentimes, these self-stigmas are sort of based on these externalized messages that we've received over time. So if I'm constantly hearing or seeing images that equate mental illness with violence, or there goes that crazy person, I might internalize, that as, somehow meaning to be, I might somehow internalize that to be true, right? So if I myself start to struggle, it might lead me to have thoughts like I'm not worthy, I'm incapable. And then the more those thoughts persist, it might lead to this sort of why try effect, right? So if I feel I'm not worthy, if I feel I'm incapable, the world tells me I'm not worthy, the world is telling me that I'm crazy. It's like, well, why even try, right? So that why try effect might lead people to not seek out help. It might lead me to isolate myself even more, which furthers, sort of increase my mental health symptoms and also sort of reinforce that stigma that I have for myself. So this self-stigma really leads to diminished care seeking and treatment engagement, right? So, and this we see as one of the worst outcomes for recovery. So if people already have their own internalized stigma about, mental illness or their own struggles, they're less likely to sort of be consistent in adhering to any treatment recommendations that, the providers may have. So another type of stigma is public stigma. And so, as we can see, different from self-stigma, so public stigma are sort of these stigmas that are faced on an external level. So that's within systems, within groups, and certainly how that individual relates in their community. And public stigma can show up in housing and employment, healthcare, and in education. So as I mentioned, if I have these stereotype prejudice beliefs about someone with a mental illness, I may not hire them. I may certainly not provide housing to them. Healthcare, it might influence my ability to even give them accurate, not just diagnosis, but treatment, and certainly on an educational level as well. So why is stigma a problem? Why should we care about this, right? So stigma is a huge problem because, number one, it just really prevents people from seeking treatment and getting support, right? So stigma sort of has this shame, component to it. And we think of shame as I am defective and flawed, right? So if I feel that I'm defective and flawed, that decreases the likelihood that I might reach out and get support because I'm scared that other people may judge me, right? Because I'm judging myself. Stigma is certainly a problem. As I mentioned, it leads to discrimination in jobs, education, housing, and medical care. However, stigma is something that is experienced by 90% of people with a mental health condition. So imagine how much of a prevalent problem this is. 90% of people who have a mental health condition feel some level of stigma, either on an individual basis or on a systematic basis. And stigma oftentimes, the experience of it is worse than the actual mental health condition that someone may have, right? So it's one thing if I struggle with depression. It's totally something else if, in addition to my struggle with depression, I see myself as inherently bad or crazy or, defective because I have this diagnosis and I think that other people see me in that same way. So, and which can certainly increase my symptoms of depression. So it really creates this negative feedback loop. So these are some of the reasons why, we're really hoping by the end of this lecture, we can certainly, shed some light into how we can start really, poking holes and intervening on stigma. So with that said, I'm going to transition over back to Dr. Dollinger to just shed some more information on facts that support stigma as a problem.
Thank you very much. Okay, so diving into some of the facts. So these are some statistics that I wanted to share with you all that I found to be rather eye-opening. Definitely something that surprised me. I had no idea that, mental health stigma affected this many people and on a global basis. So just starting off, mental health disorders, leading cause of disability globally. I had no idea about that. I found that in one of the medical journals I was researching for this presentation. I assume that, the number one disability might be something physical, something that's hindering you from functioning physically, but it's actually mental health disorders. Next, 1 in 3 people suffer from a mental illness during their lifetime. Now, this research was pulled from self-surveys and meta-analyses of different types of research on mental illness. From a personal standpoint, I actually think that some of this might be underreported. I actually think that, most people struggle with some kind of mental illness at one point in their life. So I would go as far as to say everybody. But from this statistic, thinking about going to brunch with some friends, you go to brunch with 6 friends, 2 of them have definitely struggled with some serious mental illness or some mental illness in their life. So think about that. Around 60% of adults with a mental illness do not receive care. And actually, a study shows that over 90,000 people worldwide found that stigma of mental illness is one of the top reasons that they don't receive care. And lastly, in a study from 2018, that surveyed over 1,000 participants, more than 30% held the stigmatizing belief that a weak personality causes depression. I thought this one was interesting because, the first thing that came to mind was when you hear someone go, therapy, I don't want to go therapy. I'm not crazy. They're going to put me in the loony bin. I don't need to go to an insane asylum. I don't need to do this. I'm not crazy. Those are these activating, phrases that we hear from people all the time that it's like, if only you can listen to this presentation, right? But again, just asserting the fact that to reach out for support about mental health is a weakness, and I also think, when you break your arm or you roll your ankle, you don't go to Ace Hardware and just like, okay, let's mend this up on my own, right? The first thing you do is you reach out for support. You call an ambulance, you go to the emergency department, you do something about it. But for some reason with mental health, we, again, like Dr. Egu was saying, we have this internalized stigma of, if you reach out for support, you're weak. And so hopefully, learning more about it, getting some more knowledge around the stigma of mental health will break through that a little bit. All right. So how does mental health stigma affect different systems? So I'm going to be breaking down different systems, but just quickly in brief, what I'll be talking about before I get into the diagram on the next slide is the different systems I'm talking about is one, an intrapersonal system, which is going to be defined as what Dr. Egu was talking about, self-stigma, the individual level. So you and yourself, that's pretty much it, and how you process stigma. The next one is called interpersonal system. So that one is your friends, your family, people that are close to you, your coworkers. I'll be talking about how does stigma kind of seep into the lives of those people, which ultimately affect people reaching out for support. And lastly, I'll be talking about a structural system, where the structural system talking more about workplace, healthcare systems, and it's going as far zoomed out as legal policies, legislation, stuff like that. Okay. So I love this slide because I took this from the journal that's kind of referenced at the bottom here, but I love it because it's a bunch of circles like eating each other, basically. So on one hand, it starts at the human individual level of an intrapersonal system. So intrapersonal stigma, again, as Dr. Egu was saying, self-stigma, internalizing the stigma. For example, you have a person who is not feeling well, struggling to get out of bed, not focusing at work, forgetting a lot of things, no longer having pleasure in things they used to have pleasure in. They think to themselves, well, maybe I should reach out. Maybe I should say something. Maybe I should talk to my doctor. And then boom, that stigma, those thoughts come in that say, no, if you reach out to your doctor, you're going to be seen as weak and they're going to make fun of you. Or you're going to, nobody else feels like this. Only you feel like this. That right there is an example of those kinds of stigma. And what happens to a person when they think those thoughts? They internalize it. They gulp it down and they say, oh, I must be weak if I can't deal with this by myself. And what does that do? Ultimately, they don't reach out for support. It gets worse over time. So that's an example of intrapersonal stigma. So moving into the interpersonal system, how is stigma related there with mental health? Well, now you have friends and family that are your interpersonal relationships that are playing out here. How does stigma affect these people? Well, lack of knowledge, for example. A lot of people that you meet around you have maybe never have had actual personal contact with someone who has been open about mental health. Now, I guarantee everyone has met someone who struggled with mental health problems. The difference is, have they talked about it? Have they made it aware? Have they normalized it? Very unlikely. So how does stigma relate to this? You have that same person that we talked about in the intrapersonal system. Now they're in the interpersonal system. Well, maybe I should reach out to support to my parents, or maybe I should talk to my friend about it, or my coworker. Well, what hinders them is, the thought of maybe your friends and family, since they don't have a lot of information, since there isn't a lot of familiarity, or there's misinformation, as Dr. Egu will talk about later in our presentation and show you some pictures of, how this reputation of scary mental health has really come into play in the media. That's still playing out with their friends and family, which ultimately you reach out for support with your friends and family. You might have people in your family or friends kind of being like, oh, that person's struggling with depression. I don't really want to be around that because I don't know what that's about, So you find that there's a little bit of prejudice and being ostracized. Again, not reaching out for support as a result. And then the next one, a structural system. So this one is a really zoomed out lens of kind of how stigma affects a larger system. So structural, meaning, an example would be healthcare systems, or not getting funding for a lot of mental health programs as a result because they don't think it's a priority, things of that nature. One example that really comes to mind is the pandemic. We're in a pandemic, hopefully kind of getting our way out of it. But right now we have tons of people who are reaching out for mental health support. Probably the one silver lining to this pandemic is that people are finally reaching out, and it's starting to become more and more normal in the media that mental health is a thing, right? Anxiety, stress. Now, how are our mental health organizations handling this? Well, now we're finding that there are months-long wait lists from different hospitals trying to get patients in for mental health. It's very apparent that we are not equipped to be handling, large masses of people who are actually reaching out for mental health because it was never a priority to begin with. And it took a pandemic to really bring that to light. Another example of how structural stigma may affect people, you have a patient who comes in with a previous mental health diagnosis. Maybe they have multiple mental health diagnoses and they come in for something separate. Let's say they come in for back pain or shoulder pain or stomach problems, something like that. Well, you have a healthcare provider who goes and looks in their medical chart and says, oh, this person has some mental health diagnoses. I don't know. I don't really want to deal with that. Maybe what they're struggling with isn't really that bad. Maybe they're just making it up. again, that stigma of how this healthcare provider has perceived how people with mental health diagnoses are is going to affect their care greatly. Okay, so this slide again just kind of reiterates what we talked about: intrapersonal being the self-stigma, the negative beliefs, the shame, the accepting the stereotypes that come up. We have the interpersonal part that tackles families and caregivers, as we talked about, and the structural component to it. One thing I do want to mention is implicit bias in the structural system with stigma. That's something, again, Dr. Egu will be delving into more, but here is where you have those quick trigger judgments that you have towards individuals specifically with mental health that will change your interaction with that person, that will change the way that you judge and view that person and ultimately provide services, whether you're a healthcare provider or you're a friend. So yeah, important to note. Okay. All right, so diving into something a little bit different, kind of switching gears here. So I wanted to talk about the relationship that mental health disorders have with physical health conditions. The reason I wanted to put a plug in here for this is because, you know, as we've said in the past, oftentimes mental health has this really kind of this taboo reputation, right? There's a lot of stigma around reaching out for support with mental health, but it's not like that. You know, you have asthma, you have diabetes, you're going to be reaching out for help, and it's okay to talk about in your social circles. You know, if anything, people think you're really brave for reaching out for help when you have certain chronic physical conditions. But it's not like that with mental health. And so what I'd like to do is shed some light on how closely tied mental health disorders are with physical illnesses. You know, oftentimes we're going to find that when you have a chronic physical condition, you are going to have some kind of mental health related thing going on, whether it's depression or anxiety or just managing stress, and vice versa. Mental health disorders often show up as physical conditions. So again, just kind of hoping that showing that, you know, the description of physical illness and mental health are kind of one and the same can hopefully normalize the idea of reaching out for support and identifying when, you know, you may have some physical symptoms that may be mental health related. Okay, so delving a little bit into more the relationship of mental health and physical health. So studies have shown that patients with chronic physical illnesses are 3 times as likely to have depression. Okay, so duh, right? That's pretty obvious. But here's the kicker. So as we see with the arrows, chronic physical illness is related to depression, but also studies have shown that people who struggle with their primary diagnosis with depression or a mental health disorder later on find that there are far more physical illnesses that come with that, you know, without the physical illness being the first thing. So these definitely have a bidirectional approach. Physical illness is related to mental health, and mental health is related to physical health. The two constantly are going back and forth. Here's an example. Take work stress, for example, something that we can all really identify with. Now, hopefully some of us are not, you know, under the gun of work stress every single day, but some of us are. So when you have work stress, when you have deadlines and you have a boss who just is, you know, completely micromanaging, and, you know, we've all been there where you have people just constantly stressing you out at work. And then maybe you go home from work and you have it more at home. You're going to find constant stress hormones being released, cortisol and adrenaline. When you have constant hormones being released, you're going to find your body breaking down. So again, going from a situation like work stress, which could lead to depression, you know, having increased stress hormones, these bullet points are examples of things that can happen over time. Some chronic physical illnesses such as high blood pressure, heart disease, diabetes. Obviously, if you're having increased work stress, you're having anxiety, you're going to have sleepless nights. If you're not getting sleep, everything's breaking down. You know, headaches and digestive issues are another one. So again, just highlighting the fact that there's a strong relationship between mental and physical health. And the last statistic here I thought was interesting. World Health Organization showed that 25% of patients using a health service, so a health service meaning going to your primary care physician, going to your cardiologist, going to your diabetes clinic, something like that, also suffer from at least one undiagnosed or untreated mental, neurological, or behavioral disorder. So again, you know, the patient that comes in who has not talked about a mental health disorder but has some kind of chronic physical condition, it's important to think about, you know, are they struggling with the mental health as well? And this last slide that I just wanted to put out there, again, just kind of seals the deal with regards to how mental health and chronic disease are really related. So just to kind of show you this relationship. So you got mental health disorders on the left, you got chronic disease like asthma and diabetes on the right, and then in the middle here, this big blue circle indicates the common causes of each. And so you see this relationship of, smoking, excessive alcohol, poor diet, inactivity. You have things like social and cultural factors are both, creating an environment for disease, chronic physical disease, and mental health. So again, highlighting how common it is to see physical disorders and mental health. Okay, so I will hand it off to Dr. Egu to talk about implicit bias.
Thank you, Dr. Dollinger. And to add to, your point that you just made, oftentimes, when people are having some of these physical manifestations, they're reaching out through their primary care providers. So, the first stop for most people is not to reach out to a psychiatrist or to a therapist or any other mental health providers. And so oftentimes it's the PCPs that are having to make the referrals. And sometimes within some certain hospital systems, you can't self-refer to the psychiatric department because that's a specialized department. So your PCP has to make that referral. So really important to really recognize and highlight, that bi-directional relationship that Dr. Dollinger mentioned between mental health and physical symptoms, especially when you're meeting with your primary care providers, to really be able to invite, other discussions or other reasons why, you're sort of having the presentation that you're having. And so, one of the things that informs stigma is this idea of implicit bias. And I just wanted to briefly touch on this. I could do a whole presentation on implicit and explicit bias, but that's for another day. So implicit bias, essentially what it is there are these sort of unconscious bias, right? And attributions that we make. So our brain has so much, thousands and hundreds of thousands of stimuli that it has to process each and every day, each and every minute. So it's not feasible for our brain to dedicate, significant attention to it. So what our brain does is that it has to make snapshots, and with that snapshot, make judgments. So we're constantly having to process information in a really quick manner. So what that does is lead to sort of some of these biases and unconscious biases and in the ways that it can show up. And so implicit bias, shows up in these judgments and or behaviors that don't always operate on a cognitive level, on a conscious level, excuse me. And oftentimes they can feel, that there's no intentionality around them. So if you've ever walked down Skid Row in LA, or if you're ever in San Francisco in downtown and you see, where there's a large homeless population, and you see, you might see substance use, you might see, an individual obviously struggling with their mental health and having maybe active psychotic symptoms. Those initial judgments that you have about why that person is there, that's an example of implicit bias. Or if you cross the street because you don't want to walk by someone that you see that's exhibiting those symptoms, that's an example of implicit bias. So with this, it's not that there's no sort of harmful intent on the individual's part. It's just some of these unconscious things that happen. They certainly impact our day-to-day interactions. And they're sort of they show up in these instantaneous decisions, right? So if I'm in downtown San Francisco and I see someone who obviously is homeless and, obviously maybe struggling with, mental illness, and my initial thought or my next thought that comes up is this person is a dangerous person, and I automatically cross the street. My intent is not that, to think negatively about that person. It's just this sort of unconscious, judgment that came up for me. And part of that is that it may be based on your personal experiences. It may be based on your own cultural environment. It may be based on biology. So what are some of the things that we're predisposed to? And it's certainly some of these personal experiences and cultural environment and judgments are also based on these external narratives that we sort of consume, right? So if I'm constantly, in media seeing negative images about a specific group, that's certainly going to contribute to my implicit biases, and sometimes explicit biases about, that particular group. So that's what implicit bias is, and hopefully we can understand how it kind of shows up as stigma as well. So why is this important? There's been a lot of research on implicit bias in healthcare, right? And so, this is one of those unfortunate realities of, being in healthcare that, hopefully, as a system can be corrected, right? So there's been multiple accounts throughout, healthcare history where there's been misuse or, sort of abusive and unproductive, unhelpful treatment approaches or lack of providing accurate care to certain groups of people because of their presentations, and mainly because of the providers or the hospitals or whatever healthcare system's own biases against the person that they're treating or against the group of individuals that they're treating. So again, part of what informs, our sort of judgments or beliefs is narratives, right? So media is one of the biggest ways that we consume information, whether it's social media, whether it's newspapers, whether it's television. So these are some articles, right, that were printed in obviously, large and very big newspaper outlets, right? So, in bold, freed mental patient kills mom, again, reinforcing that narrative that people with a mental illness are, dangerous. Also looking at the language, right? So it's not someone with a mental health diagnosis as a mental patient, right? Getting the violent crazies off our streets, right? Again, reinforcing that these are not human beings, these are somehow their value is diminished, and that makes them more dangerous. So not really recognizing the humanity of the person that we're seeing. Again, perpetuating this narrative that mental illness, either means you're crazy or you're violent, or like Dr. Dollinger said, you're weak in some way. Again, just, some more, narrative and images that we see in media about, how we relate to sort of mental health or mental illness. So what is a mental health condition? So mental health condition impacts many things, how we think, how we feel, our mood, our day-to-day functioning, right? So all of these things, as a person, we're all going to go through different variations. So it's not enough that you feel sad, for example. It's not enough that, you have days where you don't have motivation, you don't feel like you have energy. We're also looking at how does it affect your functioning, right? So if you're noticing extended periods of that and it's affecting your day-to-day functioning, then we might start to veer into that more of that disorder realm. Right? It can result, through biological and environmental factors. So for some, people, there's a family history, for example, of depression and anxiety, and that might increase your likelihood of, having a depression or anxiety as a diagnosis. For some people, it's something that environmental experiences sort of brought up. For example, PTSD, you may have had a traumatic experience that sort of led to a mental illness diagnosis. It often involves feelings that everyone experiences. So this was important to highlight. So the details may look different for everybody, but there's sort of these communal experiences that we all have. Everybody has felt worried. Everybody has felt sad. Everybody experiences stress. So these are ways in which we can connect as on a human level to really understand. I may not understand or live with depression, but I certainly can understand how difficult it is to, cope through feeling sad or struggle with, trying to manage the different stressors in my life. And so with mental health conditions, one of the things that we also recognize is that they don't go away on their own, right? And they can be intense and persistent. And as I mentioned, they interfere with day-to-day functioning. So again, just to reiterate, mental health conditions are very common. There are different stats. So Dr. Dollinger's statistics said 1 in 3. There are other stats that say 1 in 5 people experience a mental health condition. So the takeaway is it's common. Again, as Dr. Dollinger, mentioned, it's the leading cause of disability. And so this may be you, this may be a friend, this may be a family member, the person you're sitting next to, the person that you love and care about the most likely have had a period where they struggled with their mental health. I wanted to briefly touch on cultural issues. So our cultural background, where we're from, our environment really influences, how we see ourselves and how we understand things, right? So, the family that you come from, if mental illness is something that was openly discussed, you have a different relationship with a mental illness than maybe someone where it was really shunned and there was a lot of taboo and stigma, surrounding what mental illness is and how it can show up. And culture also influences how our mental health symptoms show up and manifests itself, right? And also cultural barriers can prevent, members of, for example, for minority populations from receiving appropriate care. And sometimes that looks like mistrust and fear of treatment. So if you come from a cultural background where there's been historical sort of discriminatory practices in healthcare, that might influence how comfortable you feel in seeking out traditional Western medicine and interventions. Some people have alternative ideas about what constitutes illness and health, right? So, based on your cultural background, how you identify mental and physical health symptoms will vary. Language barriers and ineffective communication. So this is actually something on a personal level that has been a challenge, right? Especially since the pandemic, where, we had to transition to a lot of virtual care. So, with language barrier, if I'm meeting with a patient and we need a translator, how do we sort of address that, right? And how does that influence how they're communicating their distress versus my understanding? So how they communicate their distress and my understanding of what they're communicating is going to be influenced by my own cultural background and their own cultural background and cultural understanding of what's going on. Certainly access barriers, right? So such as inadequate insurance coverage. Some communities and some folks, within certain socioeconomic status, insurance is an issue, right? Insurance coverage is an issue. And then certainly, with the blossoming of the mental health need in the pandemic, while that's great that people are asking for help, oftentimes people aren't able to get the help that they need because of inadequate insurance coverage. And certainly a lack of diversity in the health workforce. So if I'm seeking care and I don't see a whole lot of people that look like me, that might affect or influence my ability to feel like whether or not this is a productive sort of intervention or treatment for me. So some things to keep in mind and things that can certainly influence stigma. And then one thing I wanted to touch on is this idea of idioms of distress. So essentially what this means is your own cultural conceptualization of distress. So what are some of these cultural constructs that influence how the individual experiences and understands and communicates his or her symptoms or problems to others? So what's trauma to me may not be trauma to you, right? So if I'm dismissive of somebody, if someone's coming to me and telling me, they're experiencing a lot of anxiety because of work stress, and I'm dismissive of that, and I'm telling them just suck it up, right? That's invalidating, that's dismissive. Because maybe for me, that's what I would do, but that doesn't necessarily mean that that's something that the other person will do. And this idioms of distress also influences the level of severity and how we cope and how we seek help, right? And in some cultures, there are some mental illness diagnoses that aren't necessarily as present as in other cultures. But it doesn't mean that if someone is presenting with something that you've never seen before, that they're making it up or that, we can invalidate or dismiss them. So with all the information that Dr. Dollinger and I have provided you, what the heck can we do, right? How do we start to, intervene and really start reducing and normalizing conversations around mental illness and how to deal with it? So on an individual level, one is really these sort of ideas of affirming attitudes, right? So the first step is just really acknowledging that you're struggling. We all know when things feel different for us, right? So if you're having days where you're not sleeping well, your stress levels are high, you're losing your appetite, you don't get as much joy or pleasure from things, you're worrying a lot. I think it's helpful just to kind of acknowledge that things are difficult and that you're feeling different, right? Also understand that people with mental illness can recover, and recovery is going to vary for many people, right? For many people, recovery doesn't mean that they won't ever have a lifelong mental illness diagnosis. For some people, recovery just may mean that they're able to sort of manage their symptoms to where it's not consistently being so debilitating, but not necessarily that their diagnosis will go away, right? And again, determining your goals and interventions to reach the goals. So really being, an advocate and asserting and being assertive when you're seeking help and engaging it within healthcare systems. and also advocating, right? So this is, I would argue, Dr. Dollinger and I's way of advocating, for mental illness. As mental health providers, we're constantly advocating and we're passionate about this work. So there are ways that you can do that, right? So if that just means on social media, if you're someone who uses social media quite a bit, you're openly discussing your own struggle with mental illness, that's a form of advocacy and normalizing conversations around it. Within family dinners, if you have a child or parent or a loved one who struggles with their own mental illness, in what ways are you inviting conversations to normalize that everybody struggles and it's okay to struggle and that there's help out there? Utilizing community supports, and then some easy stuff, right? Like the language. Right? Being mindful of the language that we're using. It's not that, I wouldn't say you're depressed as I'm struggling with depression, right? Just like you wouldn't, if you have a family, a mom or a important female in your life who is struggling with breast cancer, you wouldn't say that that person is cancerous. You would say, my mother has breast cancer. So being able to use really kind language that doesn't, make it seem like, because there's this diagnosis that would be that person becomes fused with their diagnosis, and this diagnosis is all they are as a person. So use first person language and, avoid stigmatizing terms, and then, giving yourself permission to call out, people who use them. All right, so I will turn this over to Dr. Dollinger, who can give us some more ways to learn more about mental health.
Thank you. All right. So let's see. So as Dr. Egu was saying, mental health conditions can affect anyone. These are some resources to kind of look over and explore if you're looking to get more information on mental health stuff. Okay, so we wanted to put this slide in here just to kind of give, some of you an idea of what to look out for. What are some of the red flags? What are the indicators that say, hey, this might be a mental health concern? Let's go get it checked out. We've talked a lot about the stigma of mental health and like how it affects us negatively, but now we want to present you with some stuff where basically what to do, right? How to go about it. So here are some common warning signs that, time to go reach out to your primary care provider, go reach out to somebody to get some of these symptoms in check. The first and foremost, feeling very sad or withdrawn for more than 2 weeks. So what I'll be listing off here is a lot of kind of signs of depression. Having thoughts of wanting to hurt yourself or somebody else or making plans to do so. That's definitely a big indicator that you want to reach out for support, and reaching out for support can mean a friend that you can be vulnerable with, a loved one, somebody that you know really well and don't feel that worried about being judged. Or it can be your doctor, primary care provider, someone like that. The next bullet point is severe out of control risk-taking behaviors that can cause harm. So if you're finding yourself in a more impulsive state where you're kind of like, I'm going to go shopping and buy all these things on Amazon, or you're driving more recklessly, pushing it to 100 every time on the freeway, weaving in and out of lanes because you really just don't care about what happens to you. That kind of passive, what we call passive SI, passive suicidality, where it's like you don't really care what happens to you, but you're not actively trying to hurt yourself or kill yourself kind of thing. That's a big indicator. If you're feeling this impulsivity, if you're feeling that recklessness, reach out. Sudden overwhelming fear for no reason, and this is now we're kind of delving more into the anxiety component. Now, depression and anxiety like to hang out together. They go hand in hand. So if you're feeling that excessive worry, the feeling of something bad's going to happen, but you don't know why, those are indicators that you're probably feeling a little bit anxious. Obviously, dietary changes and sleep changes, not eating, throwing up, using laxatives to lose weight, those are indicators of disordered eating behaviors. Obviously, excessive weight loss or weight gain, anything that's kind of affecting your body physically severely, it's definitely something to get checked out because usually it's related to either a physical condition or a mental health condition, as we talked about, or both. Seeing, hearing, or believing things are not real. So that can be a really scary one for people to experience. And so reaching out for support in case there are hallucinations that are going on. Substance abuse. That's one of the biggest ones. I think that's one that's often overlooked too, because I think in, American culture, it's kind of okay to just drink to kind of soothe your problems a lot, or, it's okay to go out to happy hour with your friends. But when you find yourself drinking on a daily basis, or you're drinking in the mornings, or you're drinking by yourself, time to reach out. Drastic changes in mood, behavior, personality, or sleeping habits. Yes. So any kind of mood behavior. The first thing I think about is usually when people talk to me and they said, "I've been lashing out at my kids a lot more. I'm not really sure why," or "I've been lashing out at my partner a lot," or "I've been just more irritable and I don't really want to hang out with people very much." Definitely reach out. Extreme difficulty concentrating, staying still. That puts a person in dangerous or causes school failure. So basically, if you're not concentrating, if you're struggling to focus, those are some of the more milder symptoms, but definitely some of the ones that to see if these other signs are related to that as well. And the last one, intense worries or fears that get in the way of daily activities. Again, this is more of an anxiety related one. So if you're feeling like you have these fears that come up, if you feel like there's excessive worry or something bad's going to happen, that's that's like a primary sign of anxiety. So things to get checked out, food for thought. Okay, so as Dr. Egu was saying previously, see the person, not the condition. Language matters. The way I like to tell patients or tell other people about how you want to talk about mental health, because I think some people are like, "Oh, I don't know what to say and I don't want to offend people," especially in this kind of society where everyone's offending everybody. Language matters. And so I think about it like, would you say that about your grandma? And if you don't like your grandma, find somebody else who you care about, right? But I think about it like, if what I said to my grandma, if my grandma, was experiencing low mood or having depression or something, I wouldn't, or even like, even having like psychotic episodes, would I say, she's a schizophrenic? Or would I say, my grandma struggles with schizophrenia? Which one sounds better to you? It's really about how you say things. Obviously, impact and intent are two different things, right? Your intent is not to be hurtful to someone, not to be judgmental, but the impact does happen that way. So something to just be aware of. Easy way is, would I say this to my grandma? How would I say this about my grandma? Is usually my go-to. And again, always use person first language. So instead of that's a depressed person, a person struggles with depression. Again, schizophrenic versus that person struggles with schizophrenia or has a diagnosis of schizophrenia. That person's a bipolar versus has a diagnosis of bipolar disorder, something like that. Definitely try to avoid the term crazy. I think a lot of us know this, and it's so easy to get wrapped up when talking in with a group of people and talking about, "Hey, I'm not crazy," or "That person is crazy if they go to therapy." It's really easy to get involved in that. All we're asking, just be aware of it. Be aware when the jokes start to get to a point where it can get uncomfortable, especially if you have someone who struggles with mental health and hasn't talked about it yet. So just something to think about. And again, just reiterating from the last slide, connections matter. So a lot of times, and this is another common sign of struggling with mental health, is when you start to withdraw from people, when you start to release your social connections, you haven't texted back in a while, you haven't made phone calls, you're not hanging out with friends for happy hour, you're not going out with anybody anymore. Those are some indicators. So, if you know somebody who is also withdrawing, if you're noticing your friend hasn't reached out in a while, that might mean that they need support. Maybe that person is struggling to say, "Hey, I need help," because they don't know that they need help. So for you as their friend, after listening to this presentation, knowing you can see the signs now, something that you can do is actually reach out to them. Even when they're like, they don't text you back, reaching out again and saying, "Hey, you didn't text me back. What are you up to? I haven't seen you in a while. Let's hang out." Stuff like that can be incredibly helpful for someone who doesn't feel good, who is depressed or has a low mood, because oftentimes that person thinks that nobody wants to hang out with them. They have a lot of negative thoughts that come by that say, "I'm withdrawing because no one cares about me anyway." Challenge that by reaching out to them. Ask if they want help with anything. "I'm going to Chipotle. Want me to bring a burrito?" I love that. Just like offer them some food. Just be kind, and be aware. And I think we will wrap it up with Dr. Egu kind of bringing us home.
Yes, all of those points, the takeaway is, stigma is something that it really is a communal effort, excuse me, and something that we can work on. So, taking action, speaking out, both on an individual and on a systematic level. If you notice someone is struggling, again, just start a conversation. And it doesn't have to be a conversation where it starts off really in depth. Just something as simple as, hey, are you okay? Or a smile, things like that go a long way. And so, lastly, utilizing peers and mental health services. One of the biggest hallmark of successes with mental illness and recovery is the social support that you have. So whether it's family, whether it's friends, whether it's, in the community, really important, educating and advocating for yourself. And again, reaching out, so, we're here at CHOMP at Outpatient Behavioral Health Services. We're certainly a resource in the community. Please don't hesitate to contact us or have your, through your primary care, reach out to us if you need help. We are certainly here as a resource if needed. So Dr. Dollinger and I just want to, thank you for spending this time with us and for listening to our presentation. I hope it was really informative, really helpful. And I think we can open it up for some questions. I don't know, Carrie, if we have time for some questions.
Yeah.
If there are questions that we can answer.
Yeah, we have a couple of minutes, and somebody made a comment, and you were talking about the different forms of media, but somebody had made a comment about how it seems that many of the news presenters ignorantly promote implicit bias, and it appears that there is not a desire to become educated before addressing the public. And just if you want to comment on that, not really a question or.
Yeah, I think it's accurate, right? And I think, again, going back to what we said about just like the narrative out there and the ways that in which it shows up. So, I think it's being aware, being informed, and then challenging those narratives. So certainly.
Certainly. And then how do we get the attention of our leaders and lawmakers, for the county, for the city, for the state, at all different levels? How do we get their attention to this issue, and how do people get help? How do we
Yeah, that's a tough question. The first thing that comes to mind for me is kind of this, again, like the pandemic has been such a stressful time for so many of us. And this one silver lining is the fact that people are finally reaching out for support. Mass amounts of people are finally going to primary care providers and saying, hey, I need help. I don't know what's going on with me, but I'm not functioning correctly, and as Dr. Egu was saying, they're going to their primary care provider saying, my stomach hurts. I'm not sleeping well. What's going on? I'm achy, and so it's really nice to see that people are starting to reach out. And I think one way we can really communicate, we need more services. We need to really get get involved in legislation, change the way laws are around mental health, is by more people in the community, one, advocating for mental health, normalizing the fact that mental health is something that we all struggle with. All of us have struggled with mental health at one point in our lives. Being able to come to presentations like this to just, learn more information, as we were saying, from a structural perspective, a big part of stigma of mental health is just a lack of information. It's misinformation. And so learning more about mental health, if you know someone who has mental health problems, being able to do some research around it as opposed to kind of shun yourself from it. I think that is one of the biggest first steps in really getting into the policy level of all of this.
Yeah, I think the more that we can normalize and have conversations around it, hopefully you're reaching out to your representatives in your community and broader to, psychiatric facilities and resources have been notoriously underfunded. So as much as the resources, there just isn't enough resources. There isn't enough providers. Hospital doesn't have enough space to treat the overwhelming amount of need out there. And I think if you've tried to get support for your mental health within the Monterey County, for example, I know certainly at our clinic, our wait lists for therapy and psychiatric interventions are months long. And that's the unfortunate reality right now. So I think, getting funding, having these conversations around, mental health, normalizing the need, hopefully can drive, awareness and motivation to actually want to address this as a value.
Yeah, excellent. Thank you, ladies, so much. Really appreciate your time, taking the time out of your busy week to talk with us, and thank you for everybody who joined us tonight.